You may have heard the saying, if you're willing to spend money, there's no disease you can't cure, but reality is often harsher than advertising suggests. Some diseases can't be completely cured, no matter how much money and time you invest. Today, we'll discuss those completely incurable diseases to help you face reality and avoid being deceived by false promises that waste money and effort. 1. Diabetes. Blood sugar control is key, but there's no cure. Current situation. The number of people with diabetes is enormous, and related advertisements are overwhelming, with a constant stream of methods claiming to cure diabetes. Truth. The global medical community currently recognizes that there's no cure for diabetes, whether it's type 1 or type 2. Treatment goal. Control blood sugar and delay complications. Recommendations. Adjust your diet, for example, reduce high sugar and high fat foods. Exercise regularly, for example, brisk walking for 30 minutes daily. Take blood sugar lowering medication or insulin as directed by your doctor. Avoid false claims such as hereditary remedies or stem cell therapies. 2. Hypertension. Requires long-term control, cannot be completely eradicated. Current situation. Hypertension is known as the silent killer. While early symptoms are subtle, it can quietly damage organs such as the heart, brain, and kidneys. Truth. Hypertension cannot be cured and can only be controlled with medication. Treatment goal. Maintain blood pressure within a normal range to avoid complications. Recommendation. Take anti-hypertensive medications regularly as directed by your doctor. Avoid false claims such as secret blood pressure lowering formulas or miracle injections. Regularly monitor your blood pressure and adjust your treatment plan. 3. Cancer. A complete cure is not guaranteed. Early treatment is key. Current situation. Cancer treatment is fraught with misunderstandings, with many believing that expensive anti-cancer drugs or the latest therapies can completely cure cancer. Truth. Cure in medicine is a relative term. Early-stage cancer is considered clinically cured if it has not recurred within 5 years of treatment, but this does not guarantee the complete elimination of cancer cells. Treatment goal. Early detection and treatment to eliminate lesions and prolong survival. Recommendations. Get regular physical examinations to detect cancer early. Receive standard treatments such as surgery, radiotherapy, and chemotherapy. Avoid misleading advertising and approach cancer treatment rationally. 4. Alzheimer's disease. It cannot be reversed, only its progression can be slowed. Current situation. Alzheimer's disease is a devastating disease, and there is currently no cure. Truth. Irreversible damage occurs to brain nerve cells, and medication can only slow the progression of the disease. Treatment goal. Slow down the rate of memory loss and maintain self-care. Recommendations. Receive standard treatment and avoid believing in brain repair therapies or miracle brain-boosting drugs. 5. Psoriasis. It cannot be cured, only symptoms can be alleviated. Current situation. Psoriasis patients often fall into a cycle of recovery and relapse. Truth. There is currently no cure and all treatments aim to alleviate symptoms. Treatment goal. Reduce redness, scaling, and itching and improve quality of life. Recommendation. Receive formal treatment and avoid folk remedies such as cupping and plasters. 6. Asthma. No cure, only symptom control. Current situation. Asthma patients often experience sudden onset of shortness of breath, which can be life-threatening in severe cases. Reality. No cure, only medication to control symptoms and reduce the frequency of attacks. Treatment. Goal. Control airway inflammation and reduce the risk of attacks. Recommendation. Use inhaled medications as directed by your doctor. Avoid allergens and maintain a healthy lifestyle. Don't believe in miracle cures as they can delay standard treatment. 7. Rheumatoid arthritis. No cure, only pain relief. Current situation. Rheumatoid arthritis is a chronic disease with recurring attacks which impacts quality of life. Reality. Due to immune system abnormalities, there is no cure, only pain and inflammation relief. Treatment goal. Relieve pain and protect joint function. Recommendation. Take anti-inflammatory analgesics and immunosuppressants as directed by your doctor. Avoid relying on folk remedies for rheumatism to prevent liver and kidney damage. 8. Cirrhosis. Cannot be reversed, only delayed. Current situation. Cirrhosis is irreversible and will gradually worsen. Truth. Once the liver becomes cirrhotic, it cannot return to a healthy state. Treatment goal. Delay progression and prevent complications. Recommendation. Abstain from alcohol, for alcoholic cirrhosis. Take antiviral treatment as directed by your doctor, for viral hepatitis. Protect liver function and prevent complications. 9. AIDS. cannot completely eliminate the virus, only suppress viral replication. Current situation. AIDS was once considered a terminal illness, but the development of antiviral drugs has changed this. Truth. Current drugs can only suppress viral replication, not completely eliminate it. Treatment goals: suppress the virus, maintain immunity, and prolong life. Recommendations: adhere to standard treatment and do not stop medication without authorization. Avoid false claims of a complete cure for HIV. 10. Chronic kidney disease. Kidney function cannot be restored, only progression can be delayed. Current situation. Chronic kidney disease is a disease characterized by a gradual decline in kidney function, which may eventually develop into uremia. Truth. Currently, damaged kidney function cannot be restored, only progression can be delayed. Treatment goal: protect kidney function and delay the onset of uremia. Recommendations: control blood pressure and blood sugar. Follow your doctor's advice on a low-salt, low-protein diet. Avoid false claims of restoring kidney function. Summary: scientific treatment, rational approach. Key point: when facing these chronic diseases, face the reality and don't be deceived by false promises of a cure. Action recommendations: follow your doctor's advice on standard treatment. Adjust your lifestyle and maintain healthy habits. Maintain a positive and optimistic attitude and live peacefully with the disease. Avoid believing in false propaganda such as guaranteed cure and special effects. Thank you everyone for watching. If you like this video, please remember to like and subscribe to our channel. See you next time.